Hey everyone, Brendan Leslie of FLConservativeVoice.com, sitting next to the media's number 2 most hated man in Florida, Surgeon General Dr. Ladapo. Thank you very much for joining us. Number 1, of course, being Governor Ron DeSantis. You know what? You might be tied for number 2 with Christina Pushaw, the press secretary for Governor DeSantis. But that's all. It's like a badge of honor.
In these times, it is.
And the reason being that you're that number 2 most hated man, you speak the truth. And I want to talk about the truth. Healthy Florida. Tell us about that initiative and how Florida is looking to combat COVID in a more proactive way as opposed to what we're seeing in blue states.
Yeah. Thanks, Brendan. Well, what we've seen, it's just been a disaster for public health over the last 2 years, which is, public health we know has many components, right? It's about food, it's about nutrition, it's about exercise, it's about mental health, it's about relationships, and being part of a community, and it's about environmental exposures, and it's also about communicable disease. And basically, over the last 2 years, it's only been about communicable disease, and only one of those communicable diseases, right? So we've lost progress in HIV. We've lost progress in tuberculosis. We've lost progress in other communicable diseases, and everything else that is not a communicable disease that is like essential to public health. We've not only not paid attention to it, we've actually invested in policies that made them worse, like all the social distancing, for example. So Healthier You is bringing us back to the full picture of health and public health. And I'm really happy about it. I'm very excited about it. And we're trying to remind as many Floridians as possible about the steps that they can take to improve their health.
And we see much worse effects of COVID with somebody with comorbidities such as diabetes or obesity, right?
It's in some ways fascinating. I mean, almost entirely the burden of COVID mortality, which unfortunately has been really tremendous over these last 2 years, is concentrated in people with comorbidities. Even older people, that's basically the biggest identifiable risk factor very easily is age. And even among older people, if you're a healthy older person, you face a much different risk profile than an older person with comorbidities.
What are we seeing with the media? Why are they pushing this mask hysteria and always pushing some scary scenario with COVID? It's weird to ask this question to a government official, but the media back in the day was supposed to be the ones that are challenging you.
Right.
Or challenging Fauci, but now it's like they're just a mouthpiece for them. Why do you see that?
Yeah, that's exactly what's happened, right? No pushback, no questions, no challenging policies, no asking the question why. It's just been carry the line of government officials at the federal level. I don't know, but I'm grateful for Governor DeSantis, and I'm grateful for every leader who stands up to just this completely toxic scientific and political environment that we're currently in.
It's almost as if Florida and Governor DeSantis' administration is doing the job that the media should be doing.
No, that's exactly right. I mean, the questions of why and how do you know this works and why are we still doing this when it didn't appear to work they're such basic questions. But we haven't seen the media asking those questions, except for, again, places like in Florida with the governor. And of course, the answer to a lot of those questions is that, no, that's not effective, so we're not going to participate in it.
And it's funny, the media does like to ask questions, but it's usually pushing like what we like to call the blue on conspiracy theories. Okay. And the one being with you is Rachel Maddow. She's trying to say that it was a lie that you treated patients at UCLA. You want to talk about that?
That one really kind of bothered me. Because I get it that people don't like some of my ideas, or my comfort with essentially saying things that may not people don't want to hear but are supported by data. And I get it, and people say sorts of things that aren't particularly nice. I get it, but it bothered me that she and others lied about something that is factually like true. And I guess it's like, welcome to politics, Joe, welcome to politics. But no, I mean, I was, ironically, I was taking care of patients with COVID-19 in the week that the governor of California shut down the state. I was actually in the hospital. We had some of our first patients with COVID-19 March of 2020 that week. And I took care of COVID patients until the last time I was on service. And that was maybe a month or two before I came to Florida. And I take care of other patients too. My clinical work is as a hospitalist, as a hospitalist at UCLA Ronald Reagan Hospital. So I took care of patients who were in the hospital, and that's what I did.
And you know what's really annoying? It's a tactic that the media does all the time. They reached out to you with just about 2 hours before the show, after business hours, where some of your staff is pretty much already home for the day.
Right.
And they're expecting you to have these answers ready and available for them. And even though they don't get the answers in time, they still run with those lies about you.
Honestly, I mean, I think they gave our press secretary maybe like 17 or 18 minutes to respond or something, like at 9 p.m. or something like that. And I mean, honestly, I'm an honest person.
Yeah.
I'm just more comfortable that way. That's who I am. And I've just been completely just nonplussed by how dishonest a lot of people are apparently very comfortable being.
Well, what's the point of science if we're not able to question it? And the media is supposed to be questioning science, but they're not. You, on the other hand, are doing that.
Yeah, you bet. Yeah,
This is
I absolutely am.
science that the federal government is pushing.
Oh goodness, yeah, and fortunately there are other people, my colleagues, Dr. Jay Bhattacharya, Dr. Martin Koldorf, Dr. Scott Atlas, people who are willing to actually be honest about both, the findings of science and the limitations of science. And it's so bizarre to see so many scientists take the very opposite path.
And it seems to be that the federal government picks and chooses what kind of science they want to push. I want to talk about how the federal government is just, without warning, cut off all shipments of monoclonal treatments. They say that it's not effective to Omicron, but you guys still haven't been provided any clinical data that backs that up. Is that true?
That's right. And it's interesting because the federal government, they've done a lot of things that make absolutely no sense. In this particular case, they had laboratory data that showed a reduction in the affinity of these monoclonals for Omicron. Great.
Omicron is also a very lesser.
That's right. But the problem is that what you see in the laboratory doesn't always correspond perfectly with what you see in patients. And our position, which is really the position of someone who actually cares about the patients, who cares about people, is in the health of people, is, well, let's get more data about what actually happens in patients before we stop a treatment that we don't know with certainty is ineffective. And that's what you do. It's not, if you have a bunch of other options, then it's a different story. But we save our sotrovimab for our highest risk patients, but for other people, there really has not been a large supply of alternatives. So, it was a bad call. It was the wrong call. And unfortunately, but we're continuing to really support early treatment in other modalities.
Is Biden playing political games with the monoclonals? Is he doing this because he needs to push, for whatever reason, the vaccine?
My sense, honestly, particularly the fact that the decision came literally in the late afternoon or evening with no warning whatsoever, is that it has to be political. There were thousands of Floridians who were scheduled for appointments, and they found out in the middle of the night or in the morning that their appointments were canceled. That certainly looks political to me.
Are you afraid that we could lose more Floridians because we don't have these treatments accessible?
I am always afraid that we can lose Floridians from lack of early treatment. And if we had leadership from the beginning that emphasized the importance of early treatment, there would be tens of thousands of people alive now that are not.
I mean, we saw it when we had that huge Delta spike in Florida, and then you got all those state sites. As soon as you got those monoclonals, 3 weeks later, the Delta spike went right down.
You'd think that the governor went to medical school, right?
Yeah.
I mean, no one else went, right? Because he saw that, hey, there are these treatments. Let's provide access to Floridians. It's so basic. It's like stupefying.
Yeah.
And you have all these other states who have decided, who just aren't providing treatment. I mean, I don't even know where to start with that. And so many people died that didn't need to die for that
Got
reason.
2 more questions for you. Governor DeSantis, what's different about him? What is he doing differently than all the other leaders across the nation when it comes to combating COVID?
Well, I'll tell you honestly, personally, I really like him. And I really like him because he has integrity and he, honest to the Lord, cares about doing what he sees as the right thing, no matter what. And that's essentially been the basic thing, right? So vaccinations, we've provided access. We prioritize elderly people for them. We haven't tried to coerce people for some agenda that someone else happens to have. Treatment. Okay, people are sick. Well, why don't we treat them? I mean, really? Is that so complicated that other governors couldn't figure it out? But apparently it was. So, I'm an enormous fan of him. I love his integrity. And I don't think I would have worked for anyone else. If anyone else's office had called me, I don't think I would have left Los Angeles.
And my last question for you right now in Tallahassee, it's Children's Week. You were just doing a press conference about preventable deaths in children. You want to talk about that a little bit?
Yeah. Well, I've got 3 kids of my own. I love kids. They're beautiful. They're wonderful. They shouldn't be wearing masks. There's no high quality evidence that it helps them at all. And there's plenty of evidence that it harms them. And the Department of Health has a number of programs for kids. And I highlighted 2 of them in particular, which is one program that's about preventing infant deaths, just with, back to sleep and back to bed, and helping educate new parents. And another program that targets drowning prevention. And those are just heartbreaking. I mean, drownings, they really are heartbreaking. And so we have a program that is focused on education to reduce the incidence of that particular tragedy.
And we can find this education on the Department of Health website?
Yeah, you sure can.
Perfect. Yeah. Hey, that's Dr. Ladapo, the number 2 most hated man in the leftist media. Thanks for joining us on Florida's Conservative Voice.
Okay, thanks, Brendan.
Thanks.
All right, thanks, man.